I am just going to give a glimpse of one particular structure so that you can generalize these procedures to the other anatomic sites. Say for example, let's discuss about the esophagus so that you can apply the same concept to stomach, to intestine, to jejunum and all that. Coming to this esophagus, esophagus is a long muscular tube. It can be divided into three parts, which is the cervical part, the thoracic and the abdominal part. It passes via the diaphragm at the level of the T12 opening, whereby the thoracic part becomes the abdominal part of the esophagus. Here, the esophagus is in three regions, one in the cervical, the other in the thoracic, and then in the abdomen. We also call this as the upper 1/3, middle 2/3 and the lower 1/3 of the esophagus. If the patient is developing some tumor of the upper esophagus, what happens? The physician plans to do a resection, right? In that case, what he does is, he is going to join the middle 1/3 of the esophagus to the pharynx. So now he forms an anastomosis or joining of the middle 2/3 of the esophagus with that of the pharynx. So this is called as Pharyngoesophagostomy. The tumor is in the middle 1/3 of the esophagus. Now the physician removes the second part of the esophagus. He then joins the first part and the third part, which is nothing but esophagostomy. Now the problem is there in the lower 1/3, which is in the abdominal part of the esophagus. The physician resects the lower 1/3 of the esophagus and then he connects the stomach with the second part of the esophagus, and now the term would be esophagogastroscopy.